If you have rheumatoid arthritis, psoriatic arthritis, lupus, or another autoimmune disease, this video is for you. I am a double board certified rheumatologist, and for the past 3 years, I've been watching something remarkable happening in my clinic. Patients on GLP-1 medications like Ozempic, Mounjaro, or Zepbound were experiencing shocking results. In this video, I will share the real patient stories, the 2025 research, and the honest truth about how this drug will fit into your treatment, including the concept of microdosing or a low dose that almost nobody is talking about yet. Let's begin. Here is something that I want you to understand, and this is something that I wish every patient knew before they walk into my office. When you have an autoimmune disease, your immune system is overreactive. It's producing inflammation that will attack your own body, your joints, your skin, and your organs. Your medications, your DMARDs, your biologics, they are designed to calm down the immune response. And they do. But here it is the part that nobody will explain you. If you carry some extra weight, your fat tissue is producing the exact same molecules, inflammatory molecules, that your medication is actually trying to block. And that's happening around the clock, every single day. So your biologic is working at the front door, and the metabolic inflammation is flooding back through the back door. And that's why some patients that are on the right medication at the right dose, they are still not fully controlled. And this is not the biologics' fault. And this is not your fault. This is just another piece of the puzzle that was not addressed yet. And that's where these GLP-1 medications come in. Not to replace what you are already taking, but to address that missing piece of the puzzle. About 3 years ago, I started to notice something that I have not expected. I had a few patients who were seeing their primary care physicians, and they were starting to take GLP-1 medications like Ozempic or Mounjaro. And they took that for diabetes or for weight management. And when they came back to see me, something was different. Their joints were less swollen. Their inflammatory markers, their CRP or SED rate, were lower, and their flare-ups were less frequent. And some of them were telling me about more energy that actually they had in many years. And I started to ask myself, is this just weight loss, or is it something else going on there? The more I dug into the research, the more I realized that this was real, and it was reproducible, and it was happening through multiple pathway inside the body, not just because patients were lighter. The drug itself was having a direct effect on inflammation. And that's when I started intentionally to incorporate GLP-1 medications into my practice, not as a weight loss tool, but as part of the inflammatory process, as part of the autoimmune treatment strategy for the right patient. Now let me walk you through what I have seen disease by disease. Let's start with rheumatoid arthritis, because here we have the strongest evidence. Researchers from UCLA followed 173 rheumatoid arthritis patients who started semaglutide or Ozempic or tirzepatide, Mounjaro, and compared them to patients who did not took the drug. And after 1 year, the patients who were on the GLP-1 medication had significantly lower disease activity. Their pain scores dropped, their inflammatory markers, CRP and SED rate, came down, and their response to the existing rheumatoid arthritis medications improved. A larger study, over 12,000 rheumatoid arthritis patients, they find out that people who took semaglutide or Ozempic had meaningfully less joint stiffness, less swelling, and less pain at 30 days, at 3 months, and after 1 year. The researchers specifically said that this was not explained by weight loss. The drug was doing something directly to the immune system, to the inflammation. I have seen this in my own practice. I have a patient. She has been on methotrexate and a biologic for many years. She was still flaring up. She was exhausted. So we added a GLP-1 medication. 3 months later, she told me that she felt better than she had in 5 years. Her labs came back normal. We didn't change the arthritis treatment at all. We just treated the metabolic piece that she was probably missing. And she said to me, Dr. Girnita, why didn't anyone tell me about this sooner? And honestly, I don't have a good answer for that. Psoriatic arthritis. Now, let me tell you about Daniel. He is a real patient, 33 years old, 280 pounds, and he has been living with psoriasis and psoriatic arthritis for over a decade. Over the last 5 years, since I was involved in his care, Daniel failed multiple medications. He has been on several DMARDs medication and then multiple biologics. And I myself put him on a weight-based biologic infusion, one that was very powerful because that was the only option that we had. And even that was not giving him adequate control. His skin was covered in plaque. His joints were painful every single morning. And he had given up the idea that he would ever feel normal again. But 2 years ago, I added a GLP-1 medication to his existing biologic. And within 2 months, his skin started to clear in a way that he haven't seen with the biologic alone. By month 4, his joint pain was significantly better. And by 6 months mark, Daniel told me that he had more good days that he had in the last 10 years. And we didn't replace the biologic. We didn't change his DMARD. We just addressed the layer of the metabolic inflammation that was sitting underneath everything else. And the biologic finally had the chance to work the way it was designed to do. The 2025 research from the American College of Rheumatology, which is the biggest rheumatology conference in the world, confirmed what I saw in Daniel. Studies in people with psoriatic arthritis that were placed on a GLP-1 medication, it showed that they had a significant reduction in joint pain, inflammation markers, and disease activity. And Harvard researchers, they also found out that patients on GLP-1 drugs had a meaningfully lower risk of developing psoriatic arthritis in the first place. And there is one more piece with psoriatic arthritis that I think is really important. Patients with psoriatic arthritis already have a higher cardiovascular risk, or a risk to develop heart disease. And the research now shows that those that took the GLP-1 medication, they had a reduce in their cardiovascular risk with fewer heart attacks and fewer strokes. So this isn't just about your joints. It's potentially adding years to your life. But what about lupus? And what about Sjogren's or ankylosing spondylitis or other autoimmune conditions? I want to be straight with you right here because I think that you deserve honesty more than hype. The evidence in lupus is still small, but it's genuinely promising. There are a few small studies in lupus patients on GLP-1 therapy that show that they develop fewer flare-ups. There are also signals that these medications may slow down the disease progression in the kidneys. So in patients with lupus nephritis, which is one of the most serious complications that we worry about in patients with lupus, there is also a large analysis that found out that patients on GLP-1 medication had a significantly reduced risk to develop new autoimmune diseases overall. And that is a remarkable finding, but is still under study. For Sjogren's patients and ankylosing spondylitis, we don't have yet many answers. But based on what we know about how these drugs work on reducing systemic inflammation, improving the metabolic health, calming the immune system, there is also real reason to believe that the benefits might extend there too. But the research is coming and I'm watching for it very closely. Now, what I can tell you is this. I have lupus patients in my practice who have been on a GLP-1 medication for other reasons, and several of them had noticeably better disease control than before. But anecdote is not data. but it lines up with what we said and what the early research is showing us. Here is something that I want to highlight that almost nobody in this space is talking about yet. And I think it's especially important for the autoimmune community. When most people hear about Ozempic, Mounjaro, Zepbound, they assume you need to be obese to benefit. And they actually picture that you need the full weight loss dose to have that dramatic transformation. But what I have found and what the emerging science supports is that even very low doses of this medication can have meaningful anti-inflammatory effect in patients with arthritis, with autoimmune diseases, and we call this low doses microdosing. Now let me tell you another story. I have a patient. She came to me from Arizona. She was already on a DMARD and a biologic. She was maximized on those, but she still had multiple flare-ups every single month. She was exhausted and she was not overweight. We started her on a low-dose GLP-1 medication, not the targeting weight loss, just targeting the inflammation. And 3 months later, her flares went from multiple times a month to just one. Her energy came back. And we are now slowly tapering her medication down. We are reducing the dose rather than escalating or changing the biologic. But why does a small dose work? Because the anti-inflammatory effect of this medication isn't purely a side effect of weight loss. These drugs have a direct impact on the immune system, on the inflammation, and that effect begins even at very low doses, before significant weight change happens. Now, this means that patients who are not overweight, patients who can tolerate higher doses, patients who are worried about the side effects, they may still have options here. This is still an emerging area, and it has to be done under careful medical supervision. It has to be for the right patient, and if it is for the right patient, it may be genuinely a game changer. But I need to be crystal clear about something before we close, because this is the most important thing that I will say in this entire video. GLP-1 medications do not replace your rheumatology treatment. Not your methotrexate, not your biologic, not your hydroxychloroquine, not your prednisone, because they are not a substitution. They are an addition. Your standard treatment is still the foundation. The DMARDs and the biologics that your rheumatologists are prescribing are doing critical disease-modifying work that GLP-1 medications cannot do. So stopping them without medical guidance could actually lead to serious flare-ups and permanent joint damage. What GLP-1 medications can do in the right patient, again, at the right dose, under proper supervision, is to remove a hidden layer of inflammation that was preventing your standard treatment from working as well as it should be. But they make the foundation work better. Now think of it this way. If you have a leaky roof and you keep painting over the water stain on the ceiling, it looks better for a while, but the leak is still there. GLP-1 medications for some patients fix the leak. The pain, which is your biologic, your DMARD, can finally do its job. If any of this resonates with you, if you feel like you have been doing everything right and you are still not getting where you want to be, so bring this information up to your next appointment. Ask your rheumatologist about metabolic inflammation and ask whether the GLP-1 medication might be an appropriate addition to your plan. And if you want a rheumatologist who thinks about all of these pieces together, you know where to find me. I will link my website in the description of this video. Autoimmune diseases are complicated. I know that, and you know that better than anyone. But I genuinely believe that we are in a moment where the options for people with rheumatoid arthritis, for people with psoriatic arthritis, lupus, and other autoimmune diseases are expanding in ways that were not possibly 5 years ago. And GLP-1 medications are part of that. Not magic, not a cure, but for many patients, a real, meaningful piece of the puzzle that actually nobody has offered them before. If this video opened your eyes, share it with someone in your life who would still search for answers. And if you want to go deeper on any of these conditions, the next video is here waiting for you.